This is tonight's Instagram Live with the BACN and the BDNG. So an incredible collaboration. So to those watching who don't know me, I'm Rachel Goddard, part of the board of the BACN, and I'm the chair of the Education and Training Committee. And I'm joined with my colleague Anna Baker, who is also a board member of BACN, and she's the vice chair of the Education and Training Committee. And we also have Tina McKenzie and Emma Button from the BDNG. Tina, would you like to introduce yourself and tell our viewers more about you, your background, and how you became involved with the BDNG?
Yeah, absolutely. So hi everybody, I'm Tina McKenzie and I'm the lead education and development nurse for the BDNG. So I've been doing that role now for about 3 years nearly. I'd always been a member of the BDNG. I'd attended conferences, the main conference that we're having very soon in Harrogate, and also a lot of the education events. And I was working clinically at the time in Oxford, though now I'm a nurse consultant at the Royal Berkshire Hospital. So 3 years ago, I decided to split my role and still work as a nurse consultant, but then at the BDNG. And recently, I've had the great pleasure in working with you both. So we're doing a great collaboration together now. So I'll hand over to my colleague Emma just to explain who she is, and then we can chat about our collaboration.
Cool. Thanks. So I'm Emma, and my role is the in-person events education lead. So I work a lot with our subgroups, and we work together to get content and deliver fantastic education days. Alongside that, I practice in the NHS as an advanced nurse practitioner clinically, and I run an inflammatory service at Kingston Hospital, in addition to working for the BDNG.
Cool. So Rachel and I are going to kind of share these questions between us, but I'm going to kick off to you, Tina, if I may, first of all, because I'm sure many of our BACN nurses have heard of you guys and probably, may well be members already, but perhaps for any listeners joining us who are not familiar, know very little about the organisation, would you be able to just give us a little bit of an overview about the heritage, perhaps how long it's been an organisation for, perhaps your membership numbers? I know Emma alluded to the different subgroups that you've got there. Just a little bit of an overview would be nice for listeners.
Absolutely. So we're a national group, though we have got international members actually as well, and we've just taken on an international lead nurse that's going to be hopefully working a lot more with international nurses as well. The BDNG, British Dermatology Nursing Group, we invite healthcare professionals. Really, we obviously have more sort of dermatology nurses, but we actually have pharmacists, we have podiatrists, we have different sort of fields of background as well. We actually have a couple of medical students, so we have different sort of people that are involved with the BDNG. The education we provide has advanced a lot. We have grown in our teams, so now we've got 4 education nurses altogether. There's myself, Emma, we've also got Jodie Newman, and also Molly, who's up in Scotland. So we basically all together do education. So that can be anything from e-learning. So if you're quite new to dermatology, there's some basic sort of dermatology programs you can look at and have a certificate at the end of it, and then there's a couple of advanced ones on there as well. We do a lot of podcasts, as you know, so we put the podcasts out live on the BDNG website, and also that goes on to Apple and Spotify, so that means even if you're not a member that you can actually listen to them. We do a lot of evening webinars, so we do them really quite regular, and that's a huge amount of different topics. Emma mentioned the subgroups, and that ranges from skin of colour subgroups, biologic, primary care. There's a huge amount of different ones, that people are really keen to be involved in, and they also hold their own study days as well, the regional study days. So we do quite a lot of face-to-face events that Emma is also leading on that now. We've got one coming up, obviously, with the main conference in Harrogate in September, and then we've also got 4 other ones in October that I'll let Emma talk about. So yeah, in a nutshell, that's what we're all about. Membership is only £20 for a year, so we always think it's really good value.
Very good value.
Emma, I'll let you talk about the October events, because I know we've got some really exciting ones coming up there.
We have, haven't we, actually? Yes. So on the 14th of October, we're hosting some events in London. So this is super exciting. We're going to run our first menopause day. So we've got some fantastic consultants involved, and some nurses that are very passionate about this and how menopause can affect the skin. And myself and Tina will be working on that day as well, won't we? So that's great.
Yeah.
And then we've got the research subgroup. So we're quite passionate about research at the BDNG and the importance of evidence-based practice. And there's lots of members of that subgroup. So I think that will be a very good day, particularly for those who are new to research and how to get into research, and for those that are more advanced and would like to upskill slightly. In addition to that, we've got a patch testing and contact dermatitis day. So that's always an interesting one. There's updates there, and that's led by a clinical nurse specialist who's involved with the guidance a lot, writing around that. So yes, we're very much looking forward to that event. And then in November, we lead on to some more events with you guys.
Yeah, and we'll talk about those in a minute. Don't tell our viewers too soon, Emma. Talking of your conferences, I believe your main conference in Harrogate, that's your 33rd conference.
Correct.
Which is incredible. That's a real milestone for your association. Are there any particular topics of interest? You know, what have you got lined up on the agenda for that conference?
Well, we've got a huge amount lined up this year, and this is my 3rd conference that I've actually been involved in, arranging some of the talk presentations and things, which is great. I've also been as a delegate as well over the years as well, so it's always it's really good event for networking as well. So you can be a nurse that's brand new to dermatology, but you could be a nurse that's been there quite a while, and it's always great either to catch up with people or to meet new people. And it's so important. I think it's so important, these collaborations are fantastic, but to network as well. So that's one part of the conference. We do a huge amount of presentations that we collate feedback from each, when we finish our conference, and we listen to our delegates as well, the sort of topics that we want. On the very first day, we do what we name as Derm School, which has quite a lot of different talks that may be a bit more sort of basic, like even basic eczema, psoriasis, emollients, moisturizers, that kind of sort of talks, identifying skin cancer. And this is aimed at people that maybe are new to dermatology, or possibly people that want a little refresher or going into different fields of dermatology. And that's always really popular with our delegates. And then we sort of split up the main conference into different sections. For example, we might have psychodermatology, skin of colour. We've got some amazing research coming through, so we talk about that. We talk about bad beer. There's an amazing study called the Listen study that has basically it's a global study that's been based on how people with skin conditions feel, so they're expressing their emotions. So that's really important to talk about. And yeah, we have a huge amount of different aspects, and we also have some amazing evenings, don't we, Emma?
We do.
We do. We get some lovely meals, and we also have our main sort of dinner dance on the Wednesday, which is always well attended and well loved by all our delegates that go.
It sounds great. So really, really good educational event, networking, and the socialising, a bit of partying thrown in as well. Perfect.
Absolutely. Partying's important, yeah. And we also get, we get a breadth of speakers, some that people know that present all the time, but it also gives opportunities for people that maybe have never presented before. And we always support them, we never pressurise anyone into doing that, but it maybe gives scope for people that really want to do that and have a chance to present or talk about a topic that they're passionate about. And we also have quite a few different speakers, like consultants coming along, and people that have got really interesting topics to speak about, so it covers a lot of aspects.
Yeah, it sounds like it does. That's great.
So we really enjoyed the podcast that the four of us recorded together. So again, just to bring everyone else that joined us this evening up to speed, these lovely ladies here invited Rachel and I to join them in a podcast, which was basically a complete role reversal of what we're doing this evening. So Rachel and I were giving hopefully a very interesting and an insightful history of our organisation, our roles within our subcommittee, all the exciting work that we're doing behind the scenes in education training, which we're delighted to share with all our members at our annual conference in literally almost, just under a month's time in Birmingham. So more to talk about on that shortly. But I think also it was really nice to kind of talk about and touch on the run up to and the story that's kind of brought us all together as to key organisations that are working collaboratively, have achieved so much already, but have so much more that we can do together. I know we've sort of loosely discussed lots of different ways forward for what we can do sort of certainly for the rest of the year. I know we're going to be talking about the amazing conference that you're putting on for us shortly, but into next year, again, we're very hopeful that we can certainly keep that going and, bring more and more exciting collaborations together. But I think one of the things that certainly Rachel and I feel so proud about in terms of what this collaboration has meant so far, in terms of our competency, our career and competency framework, which I think everyone's probably heard us talk about a lot in the last year, which will be, ready to be presented at our annual conference once our, with our new name change and association, which is very exciting. But I think having you guys as such a strong part of that, it gives it so much value, gives it so much more credibility than it had already. And, we feel very honoured as an association that, to such, well, as an organisation with who we're just speaking to this evening, such eminent nurses, highly decorated, have looked at the work that we've done and feel that, it certainly meets standard, particularly in things like, skin rejuvenation and, even the sort of the whole context and, the way that the framework is aligned and the standards that it aligns to. So I think, it was really nice in the podcast to be able to reflect on that and talk about everything that we've been able to bring together so far. So I just wanted to just kind of mention that for the listeners this evening, because as I say, also the podcast, I don't think has been released just yet. I'm not quite sure when it's going to be ready. Do you guys
It should be very, very soon. Sometimes I think just unfortunately with the build up to conference, it's a bit busier.
It's a busy time. Yeah,
it is,
no,
but yeah, they usually release quite quickly, so we'll definitely put it out there once it's all been done. But it was an honour and a privilege to record that podcast with you, and I think and I'm sure Emma echoes this. When we first met, I was quite blown away how passionate and how dynamic you are, and reading through your competencies, we both said we were quite blown away how actually amazing, it's a good word just to use, amazing, they actually were, and it meant a lot for us to be asked to do that as well, to review that.
No, we're like collectively all of us are so delighted, and it's been a huge effort and sort of cross specialty input from so well, as you've seen, you've seen the work we've done, so no, it's fantastic to have you guys involved, to be able to add to the list of wonderful professionals involved in it. So thank you.
Wow, thank you.
Yeah, absolutely. We both we know the collaboration will continue, and we've got lots of exciting projects ahead. And it's always fantastic to work with you both, and find out more as well. I mean, professionally for us as well, just to find out more about how everything works, and that we can get this across to our members as well.
Yay.
So Emma, you've already explained to us that you're responsible for facilitating events conferences. And what we kind of hinted at earlier, very, very exciting. So BDNG are putting on a conference for aesthetic nurses on the 23rd of November down in London. Can you tell us more about that day?
Yeah, absolutely. I'm really excited about this day. So this is on the 23rd of November. It's going to be held in London. There are still spaces available for anyone that's interested. So we've got some really hot topics. So we had some good discussions. We were listening to sort of what people really wanted, what they felt that there was almost a gap in their learning. So we're going to be covering everything from a holistic skincare consultation and how we would address that perhaps in dermatology and the key things we're looking out for and red flags. We're also going to be looking at some of the, we're going to be looking at SPF as well, because that's always a hot topic, I think. And there's lots around that, lots of questions and often lots of mixed messages. So it's really good for us as dermatology nurses to have the opportunity to share that on a platform. And then we have got a talk on skin of colour as well, so I'm really looking forward to that myself. I will be presenting on acne in secondary care, and I just want to explain a bit more about how we manage it in the NHS before often they decide to go and approach aesthetic nurses for the next steps in their care, particularly after isotretinoin treatment. And we've got a really good speaker for skin lesions as well, so talking about sort of more the basic recognition of skin lesions, again your red flags, what you're looking out for. So it's a really jam-packed day actually, but I'm super excited about it, really looking forward to it, and I think we've got some fantastic speakers.
Oh, we are so excited about it, and it's something we really need as aesthetic nurses, because you know we've talked about the crossover between aesthetic dermatology, and so many times you have a patient present in clinic, oh, do you know what this mark is on my face? And sometimes you're like, oh, not sure really. So it'd be fantastic to get those basic, like red flags, when we need to be referring, what we need to be looking out for. And SPF, that is always something that people are asking to know more about, and skin of colour. So absolutely fantastic. I'm just reading the comments, and quite a few people have said they've bought their tickets.
Brilliant.
And they're really excited. So
Fabulous.
yeah, I mean, if people want to buy tickets, you can get them via the BACN website. There is a link there within the website that will take you straight through to book. Where's the venue? Tell us about the venue.
I will need to confirm the exact venue for you again,
Okay.
but it's all available. All the information with the exact address is on our website as well, along with the agenda. So you can access that on the BDNG website. Sorry, I can't confirm the full address right now off the top of my head, but it's very central.
Sorry, Emma.
That's fine. It's very central, and it's easy for people to access, and that's what we wanted as well. And we'll have to see how successful the event is in London, you know, and where else it could take us.
Absolutely.
So exciting, so exciting. So I mean, we're, you know, on behalf of our whole association, we're delighted that you guys are doing this for us, because we, you know, we're certainly under the impression, rightly or wrongly, and we'd love to think that this is the first time that BDNG have ever hosted. There is an aesthetic subgroup within the association, but I believe I'm right in saying that this is the first time that you guys have actually ever hosted a dedicated sort of dermatology study day for us, which is amazing and an enormous privilege. So I've no doubt that it will sell out, particularly at the price. And I think I'm right in saying that you guys are also offering a complimentary membership to BDNG as well. Is that correct? Which is fantastic, absolutely brilliant. I'm curious as well, though, kind of again just flipping it into reverse and looking at it from the other side. I think we've touched on this before, Emma and Tina, when we've had our meetings online. But am I right in thinking that quite a few of your colleagues working sort of more or less full-time in NHS and dermatology roles are also offering medical aesthetic treatments? Are you seeing a rise in terms of derm nurses offering aesthetic treatment?
Definitely. I mean, it works definitely both ways. We've got your sort of your NHS nurses that want to explore aesthetics more, and they're practicing in derm. They're very comprehensive in what they do, but they sort of want to take that jump, and they almost don't sometimes know how to take that jump. And that's where your competencies are going to come in. It's going to be fantastic to help almost guide people. And then in terms of the other way, we are seeing aesthetic nurses that will contact. I'll often have people contact myself saying, hey, I'm really interested in derm, or I want to upskill. How do I get into dermatology? You know, what do I need to do? Are there courses I can take, or where should I start really? And I think, you know, maybe Tina, do you want to give some advice on what we suggest to people when they're, you know, looking to get into dermatology as a registered nurse?
Yeah, I mean, we do have, in fact, I had someone today actually shadowing me, and you know, we can have people come into the, you know, we do sometimes have to have permission obviously to get them into the hospital, but you know, we're very welcome to people coming in and shadowing, or actually just having a, you know, we can do Teams. We quite often give support via Teams. It's quite easy to do these days. So we do have people that are coming in wanting a bit of dermatology, how to get into dermatology. People don't realise what we do, and that's exactly what the person I had with me today, you know, the extent of what dermatology is about. You know, it goes from babes in arms to the elderly really, and there's lots of different aspects of dermatology that you can specialize in, or you know, specialize in lots of different things as well. So we do get a lot of people wanting to come and see us because we don't actually get dermatology in our nurse training, and also the fact that if somebody wants to go into aesthetics, it's just really important, you know, to have that sort of, I would say, background in dermatology, as in some of the, like we've mentioned, some of the things we can actually identify on the skin, you know, that person may not actually have come in for, but it's identified, and what is this, what do I do, how far, you know, does this person need referred, or you know, can I give advice? That kind of questions are asked. So yeah, I think it's great. I think it's great that we can offer both. You know, I've got a lot of people that I know that do both, and it works really well. And I've got people that are purely in the aesthetic world or purely in the dermatology world. It can work, and I think by us all joining sort of together and doing it, and you know, reading through your competencies is so important, because it gives us grounding as well, you know, what we should be teaching people that have got an interest in aesthetics.
And we are, in fact, someone's just commented that they're keen to get into dermatology, so
that's good.
I'm sure they'll find this very, very
Join
useful.
us.
Yeah,
always job to do.
Join the BDNG.
Yeah.
It's a great platform to start on, isn't it, Tina? Because as Tina was touching on derm school, you know, this year we've got some really exciting stuff coming up, but often we do hands-on as well. So this year there's an emollient workshop, and we'll be showing you how to apply emollients, and it covers adults, there's pediatrics, there's acne, and as Tina had mentioned, it's such a good way to network. It gives people the opportunity to come and meet dermatology nurses, and sometimes once you meet someone face to face, you become more familiar with them, and then you can discuss opportunities that are potentially out there.
And I think also, Emma, we bounce off each other, don't we? You know, there may be pathways that we use that, you know, we don't have to start again. And, you know, if we reach out to different people through that networking that we've got, and, you know, oh, have you got a pathway, as Emma mentioned, about acne, or, you know, it's things like that that we, you know, we don't have to invent the wheel again. So it really helps by this networking is so important. Or, oh, wow, that's really fantastic what you're doing in your hospital, and, you know, try to implement that. So yeah, it really works. And I always feel that, you know, dermatology, we are quite, I would say, on the smaller scale, but we all know each other, which is lovely, and we do bounce off each other really, really well.
It's a very friendly world, dermatology.
It is indeed.
Oh, well, we're here for it. And as I say, I think everyone will see when the final document comes into everyone's hands very, very soon. It's been a great privilege as well that we've been able to combine and use your competency, you know, your accredited dermatology competencies as an appendices within ours, because I think it just kind of really underlines everything we're saying, that it just blends, you know, it's sort of, you know, they work hand in hand together. So it's great that we can actually be referring to them within our document in the appendices as well. It's fantastic. It's really good.
It's a great piece of work, and it's, you know, it would give me such confidence by going through them competencies as well. And as I said, it's been really a benefit tool for ourselves, because you know, we definitely share the knowledge a wee bit more because these competencies are there as well. So it's made a big difference, and well done. Congratulations on it. It's absolutely fantastic.
Oh, well, I've had so, you know, it's been, as I said, to emphasize it clearly, it's been an enormous piece of work for many people who've given up a lot of their time and been very selfless in terms of the amount that they've committed to it. So, you know, I wait with bated breath to see what everybody thinks in September, but I'm excited as well. I'm really excited.
You should be
full credit.
well,
Yeah, full credit to you, Anna, because you've led on those. So you've put so much work into them.
We'll see.
Incredible.
See.
And I think
fingers crossed.
I was going to say, when we first met, it was just this competencies that, you know, you were expressing, and it was so, you know, you could see the amount of work that you've done behind the scenes on this, and you know, it was really refreshing to see how passionate you were about everything. It was great, fantastic.
Oh, thank you, guys. Thank you.
And I've been reading the comments as we're chatting, and we're having some lovely comments on this live. So there's been requests for more lives.
Oh.
So yeah, BACN do, well, BAMAN, as we are changing our name.
Yes.
I must get out of the habit of saying
yeah,
BACN.
I know,
It's
sorry,
so hard.
Oh, I'm sorry.
So we do a lot of Instagram lives, but obviously this is our first one with the lovely ladies from BDNG, and I'm sure we'll do more. If that's what people want, we will do more. And there was another comment saying more collaborations. This is great. So yeah, that's really good feedback. Someone's just said they can't wait to hear about the competencies. They've no background in dermatology, but they did join the BDNG last year, and it's a really great resource.
Fantastic, that's good to know.
Yeah, and they're going to look at the November conference. Definitely look at the November conference. We're all going to be there, basically. It's going to be a wonderful day of learning. And they're looking forward to the competencies. So yeah, no pressure, Anna.
Yeah. And I was going to say, with the BDNG as well, we do a fantastic journal as well. So we do a quarterly journal. So that has a lot of information as well, doesn't it, Emma? We have a lot of people publishing in that, and that really does vary. You know, topics vary in that one. So it gets chunkier and chunkier every time. There's a lot of work that goes into that journal. So it's really
is. And every time I read it, I think I'm always learning something new. You know, it's just, I really love our journal, actually, because it's everything from learning updates with atopic dermatitis through to sort of mindfulness and how somebody sort of manages a work-life balance. So it's very useful.
It is very useful, yeah. We do like a bit of wellness, so we try and encourage. We have an article every quarter, so it's really what we do to de-stress, or you know, what we like to do in our spare time. So yeah, so it's a really nice way as well of if somebody's a bit nervous about publishing an article for the first time. So it's a nice easy way in to kind of say, you know, if they go off mountain climbing or cold water swimming, or you know, we've had everything. Baking is the next one. One of my lovely colleagues, Molly's from the Royal Berkshire, she's written all about a baking in a competition that she won. So it's lovely. First time ever published. She's so proud of it.
I can see someone's asking how can we get the journal. So if you join the BDNG, and then it's sent out to you. So it's part of the membership. So again, it's a really affordable price to join us for the year, and you do get that journal quarterly.
Yeah. It's great, and we do supplements as well. So you know, we do specific supplements. We've had research. We're going to be doing a new one on ichthyosis. So you know, we have specialist supplements that we put in. So yeah, it's always great to do. And we will sure be writing about these our collaboration and aesthetics day as well, definitely.
And
well, I do believe your next issue has somebody called Rachel Goddard and someone called Anna Baker writing for it.
Yes, exactly.
Brilliant. Can't wait to read it.
I didn't know what I was allowed to say.
Not staged at all. Yeah, not staged.
And for our podcast, as well. What platform is that, Tina? Remind me the platform to access our podcast as well, because I think that's going to be very exciting when it's released.
Absolutely. So if you're a member, you can get that on the BDNG website. That's not a problem. But you can also, even if you just put in Google to BDNG podcast, it will come up with them. But it also is on Apple and Spotify. So again, just search for BDNG podcast and that'll give you a whole selection. We've got quite a lot of massive selection on there, from ranges from bed bugs to psychodermatology to aesthetics to everything you can basically think about. And I'm always, looking for new ones as well. So if anyone's got any ideas, or if anyone likes to record a podcast, it's quite simple to do. So yeah, just get in touch.
Just to flag up one question, I'm sure you guys have probably. Fiona, the handlers for Wonder Clinic. Fiona's just said that she is a member, but she hasn't had the journal. Who's the best person for her to contact to try and get that sorted?
That would be admin@bdng.org.uk. So if you follow through, if you go on the website, you'll see contact details. But if you just reach out to our administration support, they'll be able to look into that for you.
There is an option actually as well. I think it was Fiona who said there, but there's an option if you can either get it in the hard copy, which I still like. I'm still quite old fashioned that way. I like having the hard copy. I know as well, even though she's a lot younger than I am. And but there's also the option just to get it online as well, obviously to be a bit greener and think about the environment.
Oh, I like it's like you say, it's a good thick one though, isn't it? And it's not advertising, it's content, it's a proper peer reviewed journal. It's a very good read. Yeah, it's a very good read.
Yeah, and Rob, our editor, has put a lot of effort in. It's been revamped recently, so it's looking really good actually. And as I say, we're very open to people publishing in that as well. So if anyone wants to, get in touch with us via the BDNG, then we're always open to having a discussion as well about that.
Nice.
Great. Someone's commented there's also a backlog of journals too.
There is a lot of journals out there. Yeah.
So, a question for both of you. If you were to give one piece of golden advice to an aesthetic nurse when treating skin, what would that be?
Who's going to go first? Who are you going to select to go first? Do you want me to go first? I will go first. I think sometimes if I was an aesthetic nurse, what I would want to know really is very much the basics. You don't need to be a total expert in, diagnosing, because even if we work in dermatology and I'm a nurse consultant, I would not be able to diagnose certain aspects of dermatology. So you can't be an expert in everything. So you don't need to. But I think it's identifying possibly skin lesions, or if there's maybe some eczema or psoriasis that you're not too quite sure about. It's having the basic knowledge to say, actually, this could be this. And, this possibly could need for you to see possibly a GP or somebody, or this possibly could just need some moisturizer on, or actually get that skin lesion checked out. So I think it's having that basic knowledge. You do not need to be an expert in skin, definitely.
Gosh, my tip now, isn't it? I think I often, when I'm talking to my team, I always think, the story's always evolving. So when you saw a patient 6 weeks ago, even what's happened since in those 6 weeks is often quite different. So for me, it's always just revisiting that medical history and reassuring the patient. Often they know themselves better than anybody else. So actually, if you do have a lesion of concern that you feel has changed in shape, size, colour, and you're sort of following that algorithm, realistically it's pointing people in the right direction. So it's just it's almost, as a nurse, it's knowing your red flags. So if it's something that feels it's out of your scope, when we talk about your scope of practice, that actually it's time for me to refer on, perhaps not give advice if I'm not too sure. And there's absolutely nothing wrong with that. It's always appropriate to just refer on. And like Tina said, we don't know everything in dermatology, that's for sure. And most of the time, I'm always knocking on a consultant's door to ask lots of questions and and gather support. So, and I know it can be difficult out there because you're often lone working as aesthetic nurses, but it is to, you know, lean on resources and come and get some education. And if you feel competent in your scope, great. And if you feel it's something you should refer on, please do refer that patient on.
I think it's really important to remember as well is skin is vast, but there's the vast amount of different skin conditions is, you know, unbelievable.
And nails, right? I think a lot of the time, you know, there's a tendency to think that dermatology is about skin, and you guys treat, you know, scalp, hair and nail disorders. You know, that your scope of practice and your skill set is enormous, isn't it?
And there's also quite a lot of rare conditions that you may never actually see in your whole career, you know. So you know, there's always the sort of very, very different ones, the rare ones that, you know, you wouldn't expect somebody to diagnose straight away. And that's why we have a lot of multidisciplinary meetings, because we've got experts in the room that, you know, we discuss certain skin conditions, because, you know, it takes a whole room of experts to actually come up with a plan for these patients. So it's not always straightforward.
No, in fact, we've got a question here actually from Fiona. She's saying, do you have contacts that as aesthetic nurses we could, you know, we work outside of the NHS, that we could actually refer to if we did have concerns with a patient? What would your advice be? They're in private practice.
I think my advice would be that obviously we're practicing in the UK, so for me it is a referral to the GP. So I know particularly for the area that I work in, it needs to come via the GP, because we're triaging it as to whether it needs to be seen in secondary care. Not everything needs to come into the hospital. Some things can be managed in an intermediate care service or with GPs that have special interest. Obviously you do have private dermatologists, absolutely, but personally I don't necessarily recommend one individual person. I can point people in the right direction to say, hey, if you go and look at this, and you would need to make your own informed decision. I don't know, what do you think, Tina?
Yeah, totally. And it varies in areas as well, doesn't it, Emma? You know, what's actually available in each area. So yeah, I mean, even in secondary care, when, you know, we maybe have to look in other directions as well, there's no specifics. There's no one specific really that we would say, oh, go to this clinic. I think, you know, it's basically possibly GP most of the time, really, and then advance further if needed.
Yeah, someone's just added a comment actually. So some areas do have a community dermatology service who take referrals.
So that's interesting, definitely. I know that's probably an area that might be slightly more advanced with the sort of more intermediate care service. So that's great if they can take referrals from external nurses. That's brilliant. Not currently in the area I work, unfortunately.
Yeah, and our hospital, we go out every month to GPs. We've covered every GP in our area just to give education, because quite often you may not get nurses that are totally specialised in dermatology in primary care as well. So and then there is some absolutely phenomenal nurses in primary care that, you know, have a really specialist interest in dermatology. So it varies all over the country, really. And I think working in the BDNG, that's what you realise, the variation is quite extreme up and down the country.
Yeah, apparently Bristol do. So if anyone's in Bristol, then there is that service in your area.
A good setup, yeah.
That sounds really good. I think the advice you've given is fantastic, because, you know, as I said before, we do have patients present with skin lesions, and sometimes like, oh, I'm really not sure. And I always, if any doubt, if I get that nurse gut feeling, I would say go and see your GP.
Absolutely. That's the best advice, really, because you know, we're not all experts, and even having worked in dermatology a long time, you know, you can come across something that you're really not sure about.
Yeah. And I would even, I'd feel better referring a patient back to the GP, even if it's absolutely, you know, fine. At least we've not ignored it. And quite interestingly, I had a patient going back a few years now, one of my regular patients, and she phoned up about 5 weeks post dermal filler, and she said, I've got a red mark on my face. and she said, I think it's a mark from the treatment. So I thought, well, that's most unusual, but we brought her back into clinic. It was nowhere near where I'd injected her, sent her to a GP, and then it was a 2-week referral to dermatology, and she needed treatment. She's absolutely fine now. But it just shows you a patient putting a little mark down thinking it was due to the dermal filler treatment, and actually it was something completely different going on, and needed dermatology.
Yeah,
and I think that brings it back to the, the story is always evolving, and it's reassessing that patient,
Yeah.
And like usually the patient is sometimes the expert as well, because they've lived with this skin condition for a long time. They get recurring moles, lesions, they know exactly, oh, this one's coming up, they know themselves. And it is about that thorough sort of assessment and clinical knowledge, but also working a bit more in partnership with the patient as well.
Yeah. So I think the key message for me as an aesthetic nurse is learn the basics, know what you're looking out for, but if there's ever any doubt, always refer to the GP, because that's not going to do any harm.
Absolutely. Yeah. And working as a dermatology, we do, as Emma said, we would get advice. If we're not 100% sure, then we would get advice from our colleagues as well.
Yeah. Great.
I think it's great. At the conference, you're going to cover off, particularly in terms of skin lesion, there'll be so many sort of fundamental things to cover off on that agenda that will at least sort of reaffirm that, if you don't know, don't touch it and refer, as Rachel says. Yeah. So, we're good.
This is an interesting question, and actually it was one I was just thinking that maybe I should be asking. So someone's asking, what do you think of the Map My Mole service? They've been asked about it as patients are struggling to get to see the GP, although they do recommend to go and see their GP. Have you heard of the Map My Mole service? Yeah. What do you think? Is it?
I mean, I'm not going to comment directly on the service, but I think, actually I always recommend GP. Yes, that's exactly what I would do. I recommend the GP first. I know it can be difficult to get a GP appointment, but I think if you just reinforce with the patient that they inform the GP of the red flag, so it's changing in the shape, the size, the colour, things like that, and then often they will get put on a 2-week path. There's a lot of work going into skin cancer at the moment and trying to get the referral process a bit tighter up and down the country to hit those targets. And so some of these services can be fantastic, and if that's what the patient wants to do, but I wouldn't necessarily tell them directly to go to that service first. But that's probably coming from the NHS as well.
Yeah. So any other questions? We've had quite a few come through that we've addressed as we've been going along, but we've got through all of the questions that we had planned to ask you. So if any of our viewers have any questions for Tina, Emma, or even Anna and myself, just type them in the comments. That's absolutely fine, and we'll answer those. Just see if anyone's typing away.
Good questions, though.
Very good question.
Yeah, very good.
I think this has been a great live to do. Obviously, dermatology is such an interest for aesthetic nurses and something we need more of. So I'm hoping you'll agree to do another live with us at some point.
Yes.
Absolutely. Yeah, absolutely. And I think for us as well, it's really important and to get our message across for the BDNG, the work we do, and sort of say, that again, if anyone's interested, to get in touch with us, either directly or through the BDNG as well. We're always happy to support healthcare professionals.
Yeah.
Oh, that's a good question.
Who
wants to take that one? Who wants to take that one? It's a really, really good question, though.
So they're a triage nurse with limited experience in dermatology and no aesthetic experience, but they're interested in aesthetics. So where would they start? So I guess that's a question for you and I, Anna, more than dermatology. If they've got limited experience, well, if you've got limited experience, you'll probably want to grow that experience more in conjunction with learning about aesthetics. My immediate advice would be to join BACN, soon to be BAMAN, and also join the BDNG. That's where you're going to get your networking and access to conferences. In terms of how to get started in aesthetics, then you would be looking at training privately. So I would recommend that you do some research in the area that local to you, unless you're willing to travel for your training. Look at the credentials of the trainer. Are you training with a nurse or a doctor or a dentist? How long have they been teaching for? What experience do they have? And then look at what you're actually going to get out of that training day. I would personally be looking at small group training. You don't want a day where you've got 20 delegates. You will just come away and not feel confident or comfortable at all. You need lots of hands-on experience with an expert trainer, and you also need to understand the theory side of things, complications management. So I think really do your research, take your time, and choose where you go for your training wisely. And also see it as an investment in your career. So don't look at the cheapest course either. And ask how many models you'll get to work on, how much hands-on experience, how many of the delegates are on the course. So that would be my, as a trainer, that would be my advice as to what to look out for. I'm sure Anna's got something to add. I'm sure Emma and Tina will as well. So Anna, have you got anything else to add to that advice?
No, I think it's very, very good, wise, learned experience. Rach, as you know, obviously wouldn't expect anything less, of course. And I think in terms of, you know, sort of what skill set you're bringing into our specialty, you may not be a prescriber. I think if you're not a non-medical prescriber, I'd say it's probably something to look at as a matter of priority. Through BAMAN, we do have, like a sort of a, I can't get my words out. What's it called, Rach? Where we've got that pot of money, I can't get my words out.
Bursary.
Thank you. Sorry, I wanted to say sponsorship.
Pot of money.
Sorry, it's the wrong end of the day. I do apologise. Sorry. We do have a bursary available, which, you know, is not something we just hand out. You know, we'd like to see evidence that, you know, that it's earned and that, you know, it's obviously going to be put to good use. So, you know, I'd like to think as an association, we are here, as Rach said, to kind of facilitate opportunities and to support ultimately, because everyone here today is a grassroots story and everyone has started from something. And as Rach said, you know, yes, okay, it's an initial investment to just become, you know, to reach a certain standard, but that continues. You know, our sector is complex, it's rapidly evolving, and there's many layers to it. So we have to just be at the front and the safest we can be all the time. And that is, you know, an endless investment. But as Rach says, doing that very judiciously and looking out for those individuals, as Rach said, that have got, you know, the pedigree, the numbers under their belt necessarily in terms of procedures they're done, in terms of what you're looking at. How many treatments have they done? Are they treating like 12 patients a week? Are they full-time in medical aesthetics? And what support is there for you afterwards? Because complications do happen. And I believe that that should be something that the training is centered upon, to know that you can call upon someone. We have some amazing organizations available. We have CMAC and ACE, so they're both led with true experts at the helm there who can guide and support their members. Really, those are the only things that I can add to Rachel's already sage advice, really, from the aesthetic end. So prescribing, definitely something to think about. Again, we have support through BAMAN if, you know, if that's something you're considering. Mentorship, looking for safety in numbers, working in a team, and ensuring that that training gives you that long-term guidance. You know, mentoring and post course and training support is absolutely key, and considering, you know, being part of those complication organisations for membership as well.
Have you guys got anything to add from the dermatology side of things for someone who's got a basic
Yeah.
dermatology understanding as a triage nurse?
I think it's the BDNG. We all look to the BDNG when we start in dermatology. So, you know, going through the learning, there's lots of different scope there for, you know, lots of aspects, as I say, for learning. And the webinars are really valuable to, you know, log into the webinars and hear the discussions and the presentations that we do, which cover vast amount of topics.
Yeah.
And also it puts you in, you know, good stead to network as well, even, you know, through the BDNG, or reach out if you have a question. So yeah, I think from us, you know, there's a whole range in the BDNG that people can either learn from or actually become involved with different aspects in the BDNG as well. So yeah, I would definitely recommend. As I say, £20 for a year is a bargain.
It is a bargain.
It's a no-brainer. I agree.
There's another question. So, do you have any information on the use of carboxytherapy and skin issues such as psoriasis?
I don't personally at this moment to hand. I'm very much an evidence-based practice clinician, so I very much like to go away, look at literature, peer review things. So I have to be honest, I can't comment on that at the moment. I don't know about you, Tina.
I would say, yeah, we can't really comment. And I think, you know, with inflammatory, it's so advancing all the time. I mean, even as a consultant, you know, I was even reading up on new treatments today that are, you know, in phase 2 trials. I think it's just fast. It's fast paced all the time. And yeah, I would be the same. I think it has to be evidence based. You have to go through the research and make sure, you know, we've got guidelines for a reason, we've got NICE there for a reason as well.
Yeah. So obviously a lot of aesthetic clinics do have carboxytherapy, you know, treatments. So anything like that, would you kind of, from a dermatology angle, say just sit back, have a look at the research behind it, don't jump in too soon with these new treatment suggestions?
Yeah, I think as a registered nurse, it's your responsibility to go away and think about, you know, putting your patient first in terms of safety, and therefore looking at research, and particularly looking at who's funded that research. Because if that research is perhaps funded by that company that has created the machine or whatever,
Yeah.
then perhaps it might be a very small cohort study, you know, perhaps there's bias in it.
Yeah.
So it's really good to unpick it. But also, if you want to understand how to do that, then it's really good to come to our research day, because they're the sorts of things you can talk to people about and say, where do you start? Because I remember when I started with research, I was like, oh my gosh, this is a minefield. And now I'm getting into the flow of it a bit more. Tina does a lot more than I do, but yeah.
Completely. I mean, to be honest, it is unpicking the research, really. It really is. How robust is this research, you know, and how good is that evidence, you know? So it is like that. But yeah, we're always happy to help with that one.
Great. We've still got questions coming through. So how do you recommend treating someone aesthetically with a past medical history of alopecia?
I think, again, I'm just a bit conscious of going too much into talking about detailed treatment plans, because for me, without, you know, again, I don't want to seem like trying to get out, without seeing that patient in front of me and assessing it. And also, we have a hair specialist at where I work. I would be leaning on her as well as a consultant, because I'm working within my scope to know, actually, is it definitely alopecia? Was it a diagnosis of alopecia that came to you before you pursue any treatments at all? Does that, I don't know if that sort of helps at all.
Though hair is really complex, and I think, just to put my sixpenny worth on this, I think we're seeing an explosion of you know, very promising treatments come to market within our sector, because hair loss is a huge problem now. You know, something I've suffered of, you know, sort of post-COVID. And but again, I think we're reminded that, you know, there's hair loss, and then there's hair, you know, there's so many different pathologies and things, and we can't just put them all in one box with one cause. It's complex. So I think, again, it just really reinforces we have to be very, very careful in terms of identifying.
Definitely. And it must
be a competence in terms of, if you don't know what the type of hair loss it is, should you really touch it?
And it's very hard hard, and it must be,
Yeah.
you know, it must be challenging for you as an aesthetic nurse in terms of the psychological element of it, of having hair loss. There's a huge psychological, you know, psychoderm aspect to that, and how is the patient best being supported with that as well, you know? So yes,
I think as well that, you know, treatments are limited, and I ran a lot of hair clinics, and as Emma quite rightly says, you know, we still go to the experts, you know, there's these specialized consultants, because again, you know, not every consultant specialized in hair or nails, you know, we have consultants specialized in different aspects of dermatology as well, so we kind of, you know, reach out as well. And I think hair loss, there's so many different and
It's complex. Yeah.
is, you know, and there's a difference as well, the psychological aspect with male and female and eyebrows, all these different aspects. So eyelash, if you're losing that on your, you know, your facial hair as well, it can be huge. It's a huge area.
Yeah, I think you've got to be very careful and very sensitive to managing the patient's expectations as well.
Totally.
It's very, very tricky, very complex area, isn't it? Somebody else who works in primary care, they're asking, is there guidance or a policy when it comes to offering or suggesting private aesthetic treatments when you're actually seeing them within an NHS facility?
I've not come across any of that in my career.
there isn't. The message I give to my inflammatory team and how I like them to work is that you can point patients in the right direction. There's a fantastic website called acnesupport.org, and that talks about all the different types of scarring and then the types of treatment you can have for it. So then it helps the patient to make an informed decision of perhaps where they'd like to go. Sometimes if it's very complex, we might be saying, you know, look for maybe a CQC registered clinic, but that's if they need quite, you know, significant treatment, like with some of the lasers and things. So it's what we don't do is we never say go to this individual, you know. We could say, or, and that's, you know, that's one part of it we tackle, because also we tackle TikTok as well, you know, because so much is coming through to us on TikTok as well, and what the patients are suggesting as post treatment scarring for, you know, with acne. The scarring afterwards is really quite significant now. So again, we don't have any particular people that we refer to, but we can advise to head in a direction for a registered nurse or a consultant, a doctor.
I think it varies, and you know, in some hospitals we do have laser. I've worked in a hospital that does, and you know, obviously we've got that there and then, but you know, very few do. It's more private, so I think it can be tricky, and I think you have to be very careful with that one as well.
Yeah, I think that's really good advice, and it's just making sure, looking after the patient's safety. So, you know, make sure you're seeing a doctor or a nurse.
And if you're unsure, you would not do that. You know, you wouldn't prescribe if you were unsure. So it's actually thinking what you're, you know, safeguarding yourself as well.
Yeah. Yeah, absolutely. Oh yeah, someone said join BAMAN. It's lonely on your own. Yeah. Yeah, and obviously join BDNG as well. Join both.
Very nice.
Yeah, wonderful for the networking, the peer support. Someone's thanking us, all very informative. I think we've got through all of the questions. So thank you so much for joining us tonight. Thank you to all of our viewers. Hope you find it really interesting. I've really enjoyed being part of this live tonight. Big thank you to Tina and Emma, and also to Anna. Thank you, everyone. We will plan another Instagram live to do this again, because we just love this collaboration, and it's going to get bigger and better, isn't it? Our collaboration.
It really
so there'll be a lot more to come. As soon as the podcast that we did together is available, we will. Tina's already told you how you can find it, but we will put that out via BAMAN as well. So we'll point you in the direction to watch that. So you've got that to come as well. Another comment. Thank you. Super interesting. Oh, I'm glad you've all enjoyed it. So we'll say good night. So thank you, everyone, and we'll see you on the next Instagram
Thank
Live.
you. Thanks,
So
Rich.
thanks,
Thanks, Anna. Bye,
everyone.
Tina.
Forward to the next one.
Bye.
Thank you, guys. Have a lovely evening.
You too.
Bye.
Bye.